Hello, this is KHURRAM Nasir and you're watching Optometry with KHURRAM again. And finally, we have started another playlist of the Optometry, which is called the low vision. We are going to achieve another milestone of the Optometry, which is called the low vision, right? So in this video, we are going to learn about the brief introduction of the low vision and particularly and specifically the definition of the low vision. Why? Because we have so many misconceptions and we have so many misunderstanding while we are dealing or while we are reading the definition of the low vision, right? So the standard definition according to the WHO is the impairment of the visual functioning in the better eye even after the treatment, and standard refractive correction and visual acuity of the better eye is less than 6/18 to the light perception, or the visual field loss is less than 10 degree from the point of fixation. So this is actually the WHO's definition of the low vision. So now we will understand each and everything of this definition, right? So remember one thing, that the low vision is actually the impairment of the visual functioning. We are talking about the visual functioning, right? So in the visual function we have so many things, right? And we have visual acuity, we have visual field, we have contrast sensitivity, and so many things. So in low vision, we are not just talk about the visual acuity. We will talk about the visual field as well, right? So he's saying, the WHO's definition is saying that impairment of the visual functioning in the better eye. So in low vision, we will discuss about the better eye. We will not discuss about the worst eye, right? So impairment or loss of visual functioning in the better eye even after the treatment and standard refractive correction. So for example, if patient requires any surgery, you perform surgery. Patient required any spectacles, you prescribe. Patient demands contact lens, you prescribe. You have given every modality, every mode of treatment to the patient, but still the visual acuity in the better eye of the patient is still less than 6/18, right, to the light perception. You know very well that what does it mean when we say visual acuity is less than 6/18, right? So less than 6/18, it means that patient is only reading the first three lines, right? Patient is reading either 6/60 or 6/36 or 6/24, right? So patient is reading only three first lines of the Snellen chart or less than that. For example, if we move from 6 meter to 5 meter, then we will move. If patient is not reading even a first letter of the Snellen chart at 6 meter, then we will reduce the distance. We will move to the 5 meter, then 4 meter, then 3 meter, then 2 meter, then 1 meter. And after 1 meter, if patient still not reading the top letter at 1 meter, then we have three different options, right? We have counting fingers, right? And we have another option, like we have hand movement, right? We have perception of light and no perception of light, right? So who is the patient of the low vision actually? In terms of visual acuity, the low vision patient is if he got visual acuity less than 6/18 to the light perception, right? So this is actually the low vision patient, but we will discuss visual field as well, right? And what are the parameters in visual field? You know very well that the visual field in normal patient is like if I say, in the temporal side is different, in the superior side is different, in the nasal side is different, and in the inferior side is different. The visual field is different in different sides. The maximum visual field is in the temporal side, in the lateral side, right, away from the nose. So it is 100 to 90 degree in the lateral side, right, 60 degree in nasal side, 60 to 65 degree in superior side, and 70 degree in the inferior side. This is actually the normal parameters or the normal values of the visual field in a normal person, right? And what about the low vision? Remember that in different books, there are two school of thoughts, right? Number one says, if the visual acuity of the low vision patient will be less than 6/18 to the light perception, right? And if we talk about the visual field, we have two school of thoughts. Some book says that if the visual field is less than 10 degree from the point of fixation, this is one statement. And the statement number two is, some book says that if the visual field of the low vision patient is less than 20 degree from the largest diameter. So we learn about these two different statements. So the first statement is the visual field of the low vision patient will be less than 10 degree from the point of fixation. So what is point of fixation, right? So point of fixation is actually the primary position, the central point of my eye, right, which is connected to the macula, right? So this is the point of fixation. For example, from the point of fixation means from the center. If I got less than 10 degree of visual field from the point of fixation, from the point, what is the point of fixation? The point of fixation is actually the central point. So from the center, if it is less than 10 degree from the center to the nasal, to the superior, to the inferior and to the lateral. So if from the point of fixation, the residual visual field is less than 10 degree, this patient will be under the category of the low vision. This is one statement. And some book says that if the visual field of the low vision patients is less than 20 degree from the greater diameter, from the largest diameter. So what is the largest diameter now? We have two different diameters when we will study the visual field, the perimetry, right? One is the vertical and another one is the horizontal, right? So if these both are the largest diameter, right? So in every side, in every direction, like one direction, if I close this eye, this is my nasal direction, this is temporal, this is superior and this is inferior, right? So we have 4 different quadrants in the perimetry. So if the visual field is less than 20 degree from the temporal side, less than 20 degree from the nasal side, less than 20 degree from the superior side or inferior side, that will be my the greatest or largest diameter, right? And you know very well that in low vision patient or in normal patient, we have two major largest diameters. One is vertical and other one is the horizontal, right? So if we have less than 20 degree of visual field in every quadrant, like in temporal side or in nasal side or superior side or inferior side, that will be the largest diameter. So if we talk about the point of fixation, the central point, the visual field will be less than 10 degree from the point of fixation, right? And if we talk about the largest diameter, it could be in the temporal side, or it could be in the nasal side or superior or inferior side. So this is some stuff about the visual field in low vision. So what is the crux of this video, what we have learned in this video? Remember, a low vision patient, if you prescribe every treatment in terms of surgery, in terms of contact lenses, in terms of any device, right, in terms of contact lenses, you have prescribed, you have given every possible treatment, every possible modality to the patient, but still the residual visual acuity in the better eye of the patient is less than 6/18 to the light perception, right? And the visual field is less than 10 degree from the point of fixation or less than 20 degree from the largest diameter. So this patient will be under the category of the low vision. I hope this is clear. In the next videos, we will discuss about how can we make a history sheet of a low vision patient, the assessment of the low vision patient, right, and management and treatment of the low vision patient. See you.